When someone approaches me with pain from lumbar spinal stenosis, I get excited. I'm not excited that they have pain, but I'm excited because I know their potential. I have seen so many patients improve in their posture, their ability to stand and walk, and doing all of that while reducing their back pain. You can absolutely do that. It can be done, and you can rely less on assisted devices, but there is some work that's going to have to be done. And when a patient approaches me with these symptoms and the pain from spinal stenosis, 90% of the time we start with this. This is a suspension trainer, and this suspension trainer is a nylon trainer. It's not stretchy. It has handles at the end, and it will attach to any door in your home. This suspension trainer, when I show my patients, their eyes widen and they're like, I don't know if I can do that. That sounds too advanced for me. I promise you it's not. And the great thing is I'm going to teach you how to safely and effectively use this to improve your strength and endurance and ability to stand and walk and not aggravate your symptoms at the same time. And so I will go over how to set it up, but a suspension trainer is a great device that you can use at home. I'll put the link in the description so you can get it if you don't have it, but I'm going to teach you how to attach it to your door. And then more importantly, I'm going to teach you 5 exercises to go over not only improving pain, but strength in your legs. And I promise you, if you do this program for 1 week, you're going to notice benefits. But if you do it even longer, let's say 4 weeks, 3 times a week, you go through this program, I promise you, you're going to feel stronger, have greater endurance, and improve your ability to stand and walk. And so before I waste any more time, let's get into it. Let's set up the device, and then let's get into the exercises. So when you purchase the suspension trainer, if you already have this set up in your house, you can ignore this part. But if you don't have this, you're going to purchase the suspension trainer. Inside of it is going to be like a block or a cylinder, and then it's going to have a nylon rope, and then you're going to attach the handles to it. There's usually like a little hole there that you can anchor it in. And so you're going to find a door in your home, and you're going to put this on the other side of the door and then shut the door. It's going to be at the top. Now you want to make sure that this door does not open towards you. You want to make sure it opens away from you because you're going to leverage kind of the door and then the trim around it to make sure it doesn't open when you're using it, because that would be awful. And so find your door, loop it around the top, shut the door, and then get ready to do some exercises. And before you start the exercises, make sure you tug on it here and make sure it's not going to slip and fall. So I've never had that happen to anybody, but you just want to make sure. So I'm going to actually detach this here because I'm attaching it to the bar behind me to demonstrate the exercises, but make sure you set it up around your door, and then we're going to get started here with the 5 exercises that I would be doing and that I show my patients to do for lumbar spinal stenosis. Okay, so you've had this suspension trainer attached. We're going to get to the exercises now. So we're going to start off with what I call an L stretch or a standing lumbar stretch. And so you're going to straighten your arms and stick your butt out, and you're going to enjoy that nice lumbar flexion stretch. And if you have spinal stenosis, you know that bending over and sitting feels really good. And we want to warm up the back here. So we're going to use this flexion moment of the lumbar spine to feel a good stretch in the lower back. Now, some people like to stick their butt out and feel a really good stretch. Some people will come way back and kind of stretch into it. It really doesn't matter. We're going to spend about a minute here stretching the spine, coming up. Now, some of my patients, because they have lumbar spinal stenosis, they're typically a little bit older when they have this condition. And sometimes they have a little bit of a shoulder pain or upper back pain or neck pain. So feel free to drop an arm if you have shoulder pain. If that really bothers you, I've got a patient right now that we do that with. You're going to stick your butt out and flex forward and come down. So what's great about the suspension trainer is you don't have to worry about falling. It takes all of the balance out of it, and you can leverage this trainer to really get into deeper ranges of motion, which you see me doing right now. So you're going to feel that good stretch and then come out of it. So that's the first stretch. Should feel good. It helps reduce pain, reduce leg pain, reduce back pain. We want to stretch first. And then the next 4 exercises we're going to strengthen. So our first one here is going to be a squat. Now, you're going to stand really tall. You're going to bring your elbows in. You're going to lean back. Trust me, remember, that's why we test this thing, because we want to make sure it's not going to fall. We want to squat down and come back up. Squat down and come back up. Now, squatting is a great exercise for spinal stenosis because it is a flexion-based exercise. People typically avoid squatting, but I'm telling you, it's a good one. I use this all the time. And since you don't have to worry about your balance, you can lean back and go into the squat. So we're going to do about 12 reps here. Oh, I'm at 5, 6. We're going to do 12 reps of the squat. Now, if you guys forget the reps and sets, I'll put it in the description, but most things are going to be 2 sets of 12. And now, if you've ever worked with a physical therapist, you know that we're really bad at counting. So hold those arms in a little bit. You're going to squat down. You might even feel a little stretch in your lower back, but you're going to feel your legs start to work. We want to improve our ability to stand and walk, and this is how we do it. And so the first set of the squats are done. We're going to make sure everything is good. Make sure your body's okay. You should not have an increase of pain or discomfort down the leg. Now, you may feel your back stretching, and you may feel your legs working, but that is normal. Second set of squats here. Now, as you get better, and let's say you've been doing this for a couple weeks, you follow this program, you can go deeper into the squats. That's totally fine. You can also stand back a little bit more, and that's going to make you use your legs a little bit more. But typically, I like to have a good little lean, do that squat, stick the butt out, that type of thing. Here we go. There's 5 squats, 6. Now you like to see that the elbows are staying in. 8, 9, 10, and 2 more. 11 and 12. Now, even me, I don't have spinal stenosis, but I can feel my legs working. And this is a great device to use, especially if you're a little bit older or a little bit heavier. You could use this device, not have to worry about falling, and you could still get a really good strengthening of your legs and hips. And it works with grip strength a little bit too. And so some of my folks report that opening jars get a little bit harder as they get older. So it's a great way to strengthen. Now, get ready because we're going to move right into our next exercise, which is going to be a lunge with this device. But at any time, you could do the nice lumbar flexion stretch again to either just give yourself a break or just have some relief. So let's get ready for the lunge. We just finished the L stretch and the squat. Now we're going to move into the lunge. So grab those handles, get them close to your body, take a big step back, and you're going to pulse lunge here. So you're going to go up and down on one side. We're going to do 12 reps on each side twice. And so what you want to focus on is not having back pain or leg pain. So sometimes with stenosis, if you have that leg too far back behind you, it can start to cause a little pain. So narrow your stance a little bit. And as you do this, over time, you will worry about getting a longer and longer stance and go deeper into the lunge. But for right now, do your 12 reps on one side, nice comfortable range. And by comfortable range, I mean you're going to have a burn in your legs, but you're not going to have an increase in pain. You shouldn't be falling, but you can be using your arms to help you keep your balance. So I'm at 3 reps on my second side here, 5, 6. It's feeling good, but even for me, I can tell that I'm using my legs, my quads, my glutes, everything is firing up. Now the bonus here is that if I get taller into the lunge, I'm going to get more hip flexor stretch, which improves my ability to walk. Whew. Okay, there's 12 on that side. I'll shake it out here. Again, the next side, we're going to do 2 sets of 12 on each side. This suspension trainer is here to help me with my balance if I need it. Now, you can be as far away from your door or whatever you're anchoring on as you want. As long as you feel like you're not going to fall and that you feel good, that's where I would be. So, you can feel a good burn here. We got 2 sets of 12 on each side. There's my second set on my first leg. Big step back, 12 reps here. Now, when I'm working with my patients, I'm always looking at their knee angle, their hip angle. You don't want to have any increase of hip pain or knee pain or back pain, but you do want to feel your legs working. 5, 6. This is where things get fun because they're like, I'm dying over here. Things are burning. And that's just all a part of it. If you want to improve your posture, your ability to walk and stand, this is what it takes. It's not easy, but it can be done. So we use the L stretch, this stretch, whenever we need to help loosen things up if they're starting to feel tight as you go through the exercises. But we covered the squat, which works on everything, the lunge, which works on your ability to stand tall. And then now we're going to move on to our next exercise, which is the lateral lunge. So now the lateral lunge, we're going to use this exercise to help us improve our strength of our back, of our hips, and our ability to stand and walk. But a lot of people forget about moving laterally, side to side. They just strengthen in their ability to go forward and backwards. But the side movement is really good for glute strengthening, and you're going to be in lumbar flexion the whole time, so you shouldn't have a lot of discomfort down the leg. So you're going to have the suspension trainer close to you. Big step to the right, bend the right knee, keep the left leg straight. Now, big step to the left, bend the left knee, right leg straight. Now again, you're going to alternate. So we're going to do 20 repetitions total, 10 on each side. Big step to the right, bend the right knee, keep the left leg straight. Big step to the left, bend the left leg, keep the right leg straight. So whichever side you're lunging to, that's the knee that's bending. Now, I'm keeping the suspension trainer close. It is totally fine to be further away and do it. Totally fine to do that. But for me, I like it a little closer just because I'm a little low on space right now. So we're gonna lunge to the left, bend the left, lunge to the right, bend the right. Now, I have some people that prefer to do all on one side first, 10 on to the right before you go into 10 to the left. It's totally up to you, but you're gonna do 20 repetitions total, bending that leg, sticking that butt out, leaning forward because we wanna stay in lumbar flexion because flexion opens up the space. The issues that you have related to spinal stenosis are due to space issues in your back. So arthritis and degeneration respond well to the flexion-based exercises. Now, by this time, you should notice your heart rate's up and that you're feeling a little loose and that you're good to go. And so this is a great exercise to do. Whew, I love this. I think I'm about 20 now. Now remember, you can do the L stretch, or you could just wait 30 seconds or so before you do the next exercise. So for me, I always like doing the L stretch, stick my butt out, feel a good stretch in my lower back. Now back to the lateral lunge. Now even me, and even some of my athletes that I work with, or just my older adults that just want to be rock stars, they still get out of breath too, right? This is a hard exercise. This suspension trainer helps me go deeper into the lunge and takes out balance. But because I am going deeper into it, more muscle activation, so it's going to be a little harder. So there's 6 reps there. 4, 7, 8, 9. Now, if you guys have any questions, feel free to leave them in the description. But the lunge and the lateral lunge are probably my 2 favorite exercises as we're going through this because they're so impactful. There's so many ways that you can help people with lumbar spinal stenosis and that you guys can improve. And this is one of the ways that I like to do it because at first it gives you confidence and strength. And who doesn't want those things when they're trying to rehab from something that's as uncomfortable as back pain? So we have done the stretch, squat, lunge, and now lateral lunge. And now for the last exercise, we have the row. So the row is going to be for the upper back and posture. You're going to bring your feet closer together. You're going to lean back and row up. Lean back and row up. Now, I'm having a good tall position. The more angle that you have, the harder it is. I'm kind of slipping here in my socks. Now, guess how many reps we're going to do? We're going to do 12. So the only thing we did more reps with was the lateral lunge. We did 20, so that was 10 on each leg, but now we're going to be doing 12 repetitions for our upper back. I think I'm at 6, 7. You see my neck position? This is key, guys. This is absolutely key. My neck is not here. My neck is here. I'm doing a little chin tuck. And I've got my ability to stay tall and focus on squeezing my shoulder blades. Do not have your elbows flare out to the side. Don't do that, right? Here, keep your elbows tight against your body. 8. I think that's about 10, 11, 12. Now, if you're doing this right, you're going to feel it in your upper back and your arms, right? We're working on that grip strength too. You're going to be rowing that. You're going to be pulling that good upper back and muscles. Whew, here, row, row, row. Feels good. Tall. Good. 6. Now, if you can only start back here, that's okay. Like if you need to start taller and just get the form down, right? Ideally, I want you guys doing this 3 times a week for about 4 to 6 weeks to really notice the benefits. Hey, we got 4 more here. 10, we got 2 more. 11, 12. Whew. So that is a typical program that I'll have somebody start with when they're trying to rehab their spinal stenosis, have less pain down in their back, down their leg, and improve their ability to walk and stand. This is something that I will use to help them do that. It is safe and effective, and you guys should have noticed that you could feel your muscles burning, your body warming up, your heart rate increasing, and at the same time, not causing an increase in back pain and leg pain. If you guys have those things, send me a question, right? If you're like, hey, this exercise didn't feel great, or this exercise just felt weird and I had discomfort, what do I do about it? Those are the questions that I really enjoy. So feel free to leave a question underneath the video, but I really enjoyed going over these things. They're very impactful. You could do this with a cheap piece of equipment in your home, and you don't have to get on the ground. You can improve your ability to stand and walk, but it just takes consistency and effort. So try to do this 3 times a week, and at a minimum, once to twice a week for 4 to 6 weeks, and I know you guys will notice improvement. So I appreciate you guys hanging with me. Hope you guys had fun. And as always, stay healthy, keep moving, and take care of yourself.